Crohn's disease is an inflammatory condition that can affect anywhere from the mouth to the anus. And also there's a number of what we call extraintestinal manifestations. It can actually have other effects that affect other, just about any other organ in the body. But the most important thing is that people develop inflammation that typically involves either their small intestine or their colon, and what that often leads to is some combination of diarrhea, rectal bleeding, abdominal pain, unexplained weight loss, and just kind of general fatigue. Those are the typical symptoms we see, but as I said, there's a whole array of other symptoms that can go along with that. The symptoms can come and go, but generally the usual onset of Crohn's disease is you have a healthy young person who's just fine, and then the symptoms don't hit them like a ton of bricks. They just start to realize that, you know, I just noticed that over the last few months I haven't been feeling well. My appetite's gone down, I've started to lose weight, I started developing diarrhea, and then I had some bleeding, some low-grade fevers. So it tends to just be this gradually progressive disease. It's not like one day you're fine and then you suddenly wake up and you're very sick. It's something that comes on over time. Nobody knows. It fits under the group of what are called autoimmune diseases, where the immune system is really an amazing thing. It is built to ward off invading infections such as viruses, bacteria, and all, but it also has to recognize your own body and leave it alone. For reasons that aren't clear, the immune system can become confused and start attacking your own body. And it can attack any organ. People are familiar with the disease rheumatoid arthritis. In rheumatoid arthritis, the immune system has become confused and is now attacking joints. In Crohn's disease, it's attacking the large or small intestine, though as I said, it can attack a lot of other organs too. There is clearly a genetic component to it, and a lot of the genetics of it are being worked out, but one thing that's shown is that when you have a person who has Crohn's disease, it's not uncommon that if you look in their family, you'll find other autoimmune diseases like rheumatoid arthritis. So there's a genetic underpinning, and then something triggers it. And the million-dollar question is, what is triggering it? Interestingly, smoking has been linked with a higher risk. The Western diet, a diet that's low in fruits and vegetables, high in animal fat, highly processed foods, has clearly been linked with Crohn's disease. Unfortunately, there is no cure for Crohn's disease. There's nothing we can give you that will make the disease go away and never come back. And even when people undergo surgery for it, it can come back. But fortunately, we have an array of medications that are extremely effective. And the vast majority of people who have Crohn's disease live a very healthy life, normal life, and do quite well. There certainly are some outliers that have a tough time of it, but most people with our modern medicines and dietary education can do quite well. My best advice I can give to someone with Crohn's disease is, first of all, don't be dismayed. A lot of young people get this disease and question how it's going to impact their life. The vast majority of people do fine. They go on and get married and have children and families and have jobs. You know, keep your chin up. We can treat the vast majority of people very effectively. And then the other advice I would have is I personally do believe that there's a big dietary component, and I think you could say this to anybody, but especially for someone with a chronic inflammatory disease, that eating a really healthy plant-based diet that's low in junk food is going to be beneficial for you. And I think don't just rely on the medications, but try to get as healthy as you possibly can.